Well, Dr. Darnell here with an informational video on hypertension. I did a little research from the National Institute on Health as well as some other resources. This video is meant to give you a little bit more information and hopefully some helpful tips at the end on how to prevent hypertension. So listen all the way to the end for those helpful tips. The current definition of hypertension is a systolic blood pressure reading, or the top number, of higher than 130, and a diastolic blood pressure reading, or the bottom number, of more than 80. Hypertension ranks among the most common chronic medical conditions characterized by a persistent elevation in arterial pressure, which is the force exerted by circulating blood through the walls of the arteries. Your systolic reading, or the top number, is the maximum pressure during heart contraction, and the diastolic pressure, or the bottom number, is the minimum pressure when the heart relaxes between beats of arterial pressure readings. They always give your doctor vital information on the health and functioning of your cardiovascular system. Hypertension has been among the most studied topics over the past 100 years and has been one of the most significant comorbidities where a person has two or more diseases at the same time that contribute to the development of a stroke, myocardial infarction, which is a serious medical condition where blood flow to a portion of the heart muscle is suddenly blocked, causing damage or death of the tissue, and heart failure. Hypertension also contributes to renal or kidney failure. If your blood pressure readings are consistently higher than 140/90, then your doctor may talk to you about treating it until it falls within the desired range of 130/80. The most common blood pressure treatments may include diuretics or water pills, ACE inhibitors that convert enzymes like lisinopril, ARBs or receptor blockers like lorcatin, calcium channel blockers like amlodipine, and beta blockers like metoprolol. These medications work in different ways to lower the blood pressure, often targeting specific parts of the body's circulation. Your doctor can explain which one is best for you if they recommend the medication. Did you know that more than 1 billion adults around the world have hypertension, with up to 45% affected by the disease hypertension, which is consistent across all socioeconomic and income levels, and the occurrences rise with up to 60% of the people over 60 years of age. In the United States, hypertension alone accounts for more cardiovascular disease-related deaths than any other risk factor, and second only to cigarette smoking, is a preventable cause of death. Another study noted that hypertension is the most common and preventable risk factor for cardiovascular disease and 20% of the deaths around the world. So let's go over some common causes of hypertension. It could be an increase in salt in the daily diet, coupled with a person's sensitivity to salt, which 50 to 60% of the people have. Lifestyle management is at the top of recommendations for all people with high blood pressure, regardless of age, gender, comorbidities, or cardiovascular risk status. Education is critically important to effective blood pressure management and should always include some weight management, salt restriction, smoking management, adequate management of obstructive sleep apnea, and of course, exercise. These changes are to be continued as a lifestyle for effective disease treatment. So weight reduction is advisable if obesity is present. But weight reduction alone can result in a decrease of up to 5 and even 20 in the systolic blood pressure reading. Smoking will help reduce long-term consequences for the cardiovascular system if the person quits smoking. Lifestyle changes alone account for up to 15% reduction in all cardiovascular related events, so focus on a diet rich in potassium, low in sodium, eat more fresh fruits and vegetables, whole grains, lean protein, while limiting saturated and trans fats and cholesterol. Become a label reader, plus limit drinking alcohol, and definitely engage in increased physical activity like walking briskly for 30 minutes a day and manage stress levels. But wait, it's been scientifically proven that phototherapy greatly improves the cardiovascular system. So, consider that as part of your lifestyle change. And as always, consult your healthcare provider when it comes to managing your own personal health. God bless you, and I'll be back with you again soon.